Brian Roadhouse of Roadhouse Chiropractic. I want to invite you to the Dr. B show, today we're going to be finish up discussing the Forgotten Thyroid Patient, episode 2. If you can join us today at noon, you have to log on to Brian Roadhouse DC on Facebook. And if you have any questions that you'd like to ask, you can ask a question at askdrbshow@gmail. If we have time, we'll go over them on there. But anyway, I got a real question that a lot of our patients have. It was from Janice in Temecula, California. And she wanted to know, when is it right to use ice and when is it okay to use heat? Well, first of all, ice should be used in any acute situation. You sprain an ankle, you want to elevate it, you want to immobilize it, rest it, you want to put ice on there. Well, how soon after that, do you put heat on there? Well, you want to wait until the swelling has gone down. And a lot of patients come in and they go, my doctor, or my friend, or so-and-so told me to put heat on this. And it seems like it's gotten a lot worse. Well, if it's a neuromusculoskeletal case and you've got an irritated nerve and the muscles are in spasm, it's inflamed, and there's pressure on the nerve, a lot of patients will put ice on there first. And they go, well, the ice really didn't help. Well, the ice is not an analgesic. It's actually an anti-inflammatory. But if you get enough of the inflammation to go down, sometimes you'll get some pain relief. So let's say you've done that a couple of times and it's still really hurting bad, and you think, well, I'm going to try heat, and you put heat on there. Well, the outside part of the spinal cord is the lateral spinal thalamic tract. It carries two fibers, pain and temperature. So if you have a pinched nerve, an inflamed joint, a muscle spasm, and you put heat on there, and the heat stimulus is more than the pain stimulus, then it drowns out the pain signal to your brain. So you think, oh man, I'm finally getting some relief. And if you do that a couple of times, like we've had a lot of patients, and they had it, let's say, on their lower back, and they put it on, and about 3 days later, they're stuck like this, it's worse. Or it was here, and now it's going down the leg, you put the heat on for the wrong thing. So most of the time, if you have any question, ice is the best way to go. If you've had a chronic situation where it's not really inflamed but aching, stiffness, soreness, or if you had a long day, you can put heat on there. It brings blood into there, helps nourish some muscles, and helps to relax you. So you can make a lot of mistakes by using heat when you shouldn't. There's only 1 or 2 situations where you use ice and it's going to cause a problem, and that's if you have a blood clot into the extremity, whether it's arm and leg. The signs of that are going to be the arm or leg is going to swell. It's going to start throbbing, and if you put your finger into the area where it's swollen and red and go like that and pull it out, and your fingerprint or your finger stays stuck in there, that's called pitting edema. That's a sign that there's probably a blood clot going on there. So either one of those, you don't want to put heat or cold. That's about the only time you have to worry about that. But anyway, hope that answers your question, Janice from Temecula, and thanks for sending us a question at our email. Anyway, today we're going to be covering the thyroid. So if you know anybody that has any thyroid symptoms that aren't responding to standard medical treatment, or they've tried some home remedies, I think you'll learn some really cool stuff about thyroid. So anyway, tune in if you can today at noon, and that's Oklahoma time. I hope to see you there.